Hi, Mr. K. Welcome. Thanks for your question. I think it's a really important question. Your question was, is Motrin the best option for my headaches during the day? So, a lot of adults experience headaches during the day, and most of the time, the headaches are transient, meaning they come and go. They don't have um, like serious causes, so they are not caused by a stroke or by some serious illness going on in the body. And for those kind of headaches, a lot of people take Motrin or Advil, and I would say this is not really the best way to treat um, that kind of headache. So, in order to make sure we're on the same page, let's first of all clarify what Motrin is. So, Motrin is a medication that belongs to a family of drugs or a group of drugs referred to commonly as NSAIDs. NSAIDs is a plural for NSAID. So NSAID is an acronym that stands for non-steroidal anti-inflammatory drugs. So this means that Motrin is a medication that fights inflammation and is not a steroid. Why is this important to know? It's important because inflammation is usually how our body responds to injury, and could be a sign of healing. The body is trying to repair itself, and one of the common symptoms of inflammation is pain, and that's what makes us go looking for the Motrin. So Motrin is a brand name, otherwise also known as a company name, for an active substance called ibuprofen. So ibuprofen, a lot of people also know about ibuprofen, but a lot of times people don't understand, the difference between ibuprofen, Motrin, Advil. So they're actually all the same thing in terms of the content. It's just that the names are different. So ibuprofen is what we call the generic name, more or less like the common name for the substance, while the names change based on what company is producing the ibuprofen. So one company, when they produce ibuprofen, they'll give it a name that is specific to that, that belongs to that company. So, for example, Motrin is a name that a company gave to their brand of ibuprofen. So that's why it's a brand name. So it's Motrin, and then another brand name is Advil, which also a lot of people use for headache and other things causing them pain or pain in other parts of the body. Um, so that means that ibuprofen, Motrin, Advil mean the same thing. There are other examples of this group of medications called NSAIDs. For example, another common one that people use is called Aleve. Aleve is also an NSAID, and the active substance in that one is called naproxen. But I'm not here to give you a class in medicine. You asked me a question, and I want to be very specific and not drag this out. So, like I've explained to you, Motrin belongs to a group of medications called NSAIDs. It fights inflammation. Motrin is the same as ibuprofen, and is the same as Advil. So, in order to explain to you why Motrin is not the best option, I think we need to talk a little bit about headache. So a lot of adults experience headache during the day. A headache that comes and goes. It's not like lasting a long time. It's not like severe headache. There's a kind of, yeah. So there's sometimes we can have, if somebody has a bleed in the brain. That's a stroke, and that can cause severe headache. That kind of headache, the person has to go to the emergency room right away, or be taken there, um, or call 911 rather. So, but let's focus on the headaches that a lot of adults experience on a regular basis. Sometimes uh, those headaches come up when we're hungry, or we're dehydrated, or we didn't sleep well, or we're stressed out, by things happening in life. And how that headache is actually produced is not clearly understood. But the way the brain tells us that it needs help or needs some attention is by causing that pain. And then a lot of adults just resort to taking Motrin or Advil or Ibuprofen because that's what the advert on TV tells them to do. Um, but what the TV adverts don't tell you and all those people watching TV or making their healthcare decisions based on what they see on TV, what the TV doesn't tell you is that Motrin and Advil and all the medications that belong to that family of drugs called NSAIDs, these medications have a lot of side effects, meaning they have bad effects. That is not the main reason you're taking the medication, but those effects happen anyway, especially when we take these medications regularly over a long period of time. They can affect the heart, the kidneys, the lining of our stomach and intestines. They can affect those systems and those organs in a negative way, and sometimes it can actually cause bleeding. Um, so based on how the headaches, the fact that it's not clear that it's inflammation that is causing us to have headaches when we're dehydrated or hungry or sleep deprived or stressed out, it's not clear that it's inflammation that is causing it, and most of the time it's not really inflammation. So taking ibuprofen or Motrin or Advil for a headache during the day is not really the best option, because we are now taking on those bad effects, on multiple systems. And of course, if somebody already has a problem, let's say a stomach ulcer, or somebody's kidneys are not functioning well, or somebody's heart already has challenges, let's say somebody who has hypertension, those medications are not friendly at all in those situations, so they should be avoided. And a lot of times the TV adverts pitch these medications against a medication that is actually safer, and it's called Tylenol in this country, United States. Tylenol is a company name, otherwise saying that is a brand name. So it's a name that a company has given to the active substance known as acetaminophen. So acetaminophen is the generic name, the active substance in Tylenol. And for people from other countries like African countries or South American countries, they are probably familiar with paracetamol, and paracetamol is the same as Tylenol, is the same as acetaminophen. So both paracetamol and Tylenol contain acetaminophen. So when you go to the pharmacy, you may see acetaminophen on the bottle, and you should know it's the same as Tylenol. And a lot of times, the generic form of medications are less expensive than the brand names. Um, so it's equally effective to get acetaminophen instead of getting Tylenol. I'm not marketing for anybody, and I'm not against any company, but I'm just giving you the facts so that you can make well-informed decisions about your health. So it's really better not to use Motrin, Advil, ibuprofen for headaches. It's better to start with Tylenol. A lot of people have heard, or maybe even the TV adverts give this information that Tylenol is bad for your liver. But Tylenol is bad for the liver when it's overdosed. So if you keep to the recommended dose, Tylenol is safer, causes less side effects, causes less damaging effects. Um, Tylenol is to be avoided if somebody's liver, let's say someone is in liver failure or somebody's liver is really not doing well, then it's better for them not to take acetaminophen, um, or take it in a very reduced dose. I mean, they have to always consult with their physician or healthcare provider about medications they're taking, because all the medications we take, most of them are processed either by the liver or by the kidney. So that's why if any of these organs is already challenged, like a doctor has told us that, these organs are not performing well, we really have to be careful about taking medications, including medications that we can take without prescriptions, especially those ones, because anybody prescribing medication to you will review your health condition before they prescribe. But then if you go to the pharmacy to just buy a medication by yourself without checking with your doctors if these medications are safe for you, you may not know that you're putting your body, specifically some organs, under undue strain and may damage them further. So I really advise you, if you've not been told, you go to the doctors regularly and you've been told your kidneys and your liver are functioning well. If you have a headache that is bothering you a lot, and you can figure, you're not having any other symptoms that are concerning, it's better to try Tylenol first. And for an adult in stable health condition, You can take 500 milligram tablet of Tylenol, like 2 tablets at a time, but you should not, and make sure you don't take it with alcohol. Better to take your medication with just plain regular water. Um, and then, and then allow at least 6 hours, 6 to 8 hours before you take another dose if the headache is not relieved. And you shouldn't exceed, to keep your liver safe. I'll recommend that you don't exceed taking that dose more than 3 times within 24 hours, but always make sure you have at least 6 hours between each dose. Um, if you have more questions, you can always sign up with me to become. I mean, talk more with me to be for me to become your physician. I'm about to start an office where I'm gonna be taking care of adults who sign up to become members of my clinic. It's not gonna be insurance based, and it's gonna be located in Houston, Texas. So, but stay tuned. Keep revisiting the channel, and I'll update you when that clinic actually is about to take off, so you can sign up if that's what you want. However, I encourage you to be regular to your doctor's visits and seek advice, before you start new medications. And, for now, channel your questions directly to your healthcare providers. So until next time, Mr. K, thanks for coming. Thanks for watching this video. And if you have any other questions, feel free to write them in the comments or use the email that is attached to this channel to send questions to me so I can address them in the next episode. All right. Talk to you soon.